My name is DLyons. This is my head to toe physical exam video demonstration. This is my patient. Have you agreed to do this demonstration with me?
Yes.
Okay. Are you feeling okay today?
Mm-hmm.
Okay. I'm going to wash my hands. During this exam, I'm going to talk about what I'm doing. I probably will not do everything I would do if we were in a hospital and you were wearing proper hospital clothes. I may ask you questions about how you feel or if anything hurts. Just answer truthfully. And I'll just have you change position a couple times and let me know if anything if you don't feel well during the exam.
Thanks.
Okay, my hands are clean. So, I'm looking at a general impression of my patient. He skin looks very pink, he looks well hydrated. Skin has just minor irritations, no lesions, no wounds that I can see. Well muscled, good nutrition. And I'm going to start by looking at the head. May I touch your head?
Yes.
Okay. So first, I am going to be looking at his head. It does look very rounded, correct shape. Hair looks well groomed, healthy, not dry. I see nothing abnormal with hair. I'm gonna touch your head. Head feels round. I feel no soft areas. I feel no bumps, contusions. Any of that hurt?
No.
I'm going to go ahead and start looking at your head and your face. I'm looking at his face. It looks very symmetrical. Skin just has slight blemish. Proportional eyes, nose, mouth, ears. No abnormal hair patterns. All right, so I'm going to start by palpating your sinuses, which are in your bones around your face. Any pain?
No.
Does that feel okay?
Mm-hmm.
Next, I am going to look at your eyes. But first I would like, I don't have the test that you would read the board on the wall, but that's this Snellen exam, and that talks about your reading ability, your ability to see a chart at 20 feet and being compared to someone else who has perfect vision at 20 feet. So, you cannot do that, but instead I'm going to have you read at around 14 inches, this line right in there.
This section is to be completed by a representative of the sending or receiving facility. Note the crew must also complete the crew signature section above.
Very good, thank you. I'm going to have you read the line above it with just cover one eye.
Alright.
This one right here.
Signature of representative of institution involved in patient care.
Okay, and now switch eyes. And read this top line right on the crease.
Complete the section only if you are unable to obtain the signature of the patient.
Okay, perfect, thank you. So next I'm going to test the motion of the ability of your eye muscles to control your eyeballs. Okay, so I would like you to follow the point of this and without moving your head, just follow with your eyes. Did any of that cause you any dizziness or headache?
No.
No, okay. Next, I am going to do a test that's talking about your peripheral vision. So I'm going to have you cover one eye. And I'm going to cover the opposite eye. And I want you to tell me when you see the tip of this come into vision.
All right. Okay. All right. Yep. Yep. Yep.
Okay, switch eyes.
Yep. 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 Yep.
Okay, very good. All right. Next, I am going to look at your eyes. I'm going to use the light and you just stare straight ahead. Okay. And now I want you to stare at that phone and then now look at this. Okay. And now, it as it comes in. Okay, excellent. Thank you. Any lights or any feeling of dizziness during any of those changes?
No.
No? Okay. Cornell light. Okay. Next, I am going to look at your nose. I'm going to inspect. The nose looks unbroken, no lesions, no drainage, no bleeding, no excessive oils. I'm going to have you plug one nose, one there, and now breathe. Okay, and now switch. Okay, very good. All right, next I'm going to look in your mouth. First I'm going to look at your lips. Your mouth is no dryness, no cracking, no rips, tears. I see no scabs or lesions. Go ahead and open your mouth. Sides of the mouth are pink. Thank you. Okay. And hard and soft palate are intact, no deviations, no wounds or burns. All right. Can you stick out your tongue for me? Tongue is pink, normal sized. Can you put it to one side, please? Actually, out and around. No lesions on the side and the other side. Very good. And now up. And open your mouth so I can see the inside. Okay, good. And can you smile? Okay. There's no missing teeth, good dentition, good dental care. All right, can you open your mouth, stick out your tongue and say ah? Uvula is present, normal size, and is located medially. All right. I'm going to try to open your mouth, and you try to stop me. Okay, good. Next, actually I'm going to go back to the eyes. I want to inspect his eyes, his sclera, his conjunctiva, his pupils, reaction to light. Okay. I'm going to have you close your eyes, and I'm going to try to open them. Okay. Very good. Okay. So next, I'm going to, actually I'll go to the ears first. Looking at the ears, they are located at the same size, same place on both sides. They are in a normal position. They are not tilted. There's no wounds on either of the ears. I'm going to just quickly look inside. No obstructions. I'm going to tug gently up. Any pain?
No.
I'm going to press on the triangles. Any pain?
No.
Let's see over here. Ear looks normal skin, no burns, no battle signs. I'm going to pull. Any pain?
No.
And any discomfort? No. Okay. From here, I'm going to check your lymph nodes. Okay. Actually, I'm going to feel for your temporal artery. Okay. And I'm going to check your lymph nodes. Anything sore?
No.
Okay. Very good. Okay. Any pain in your jaw?
No.
Are you able to open your mouth and close it for me? Okay. Are you, go ahead and open and close. Okay. Now side to side. Okay, good. And I'm trying to open. Any clicking, anything like that, grinding? Actually, go ahead and grind. Grind your teeth. Side to side, anything? No clicking? Okay. All right, very good. So now I'm going to move to the neck. I'm inspecting the neck. Slight skin irritations, normal symmetry. See no pulsations, no JVD noted here. We'll check again later. If he was wearing a jockey, I would expose this upper area and his back. Okay. So, at this point, I'm going to have him sit up straight. I'm going to feel for the thyroid. Any pain, discomfort there?
No.
Okay. While I'm here, I'm going to feel for his carotid one at a time. Okay. I'm also going to inspect the cervical spine. I don't feel any malformations, no lumps, masses. Can you go ahead and put your chin on your chest as far as you can? Okay, and as far hyperextended as you can. Okay, and turn to the right. Okay, oops, I'm sorry. turn to the left and now to the right. Okay. This doesn't, you don't turn as far to the right.
I have a fuse C6, C5.
Okay. Does that hurt when you turn?
A little.
A little bit. Okay. All right. I don't feel anything here. All right. I am going to hold pressure against your chin. Can you try to turn that way? And we'll just do it lightly this way. Okay. So I'm gonna. I want to keep your head from going down. Try to put your head down. Okay. And try to put your head back. Okay. Very good. Okay, while I'm here, I'm going to check his shoulders. Clavicle in place. I would expose it and look at it more closely. At this point, it feels like the shoulder girdle is intact. All right, I would inspect his back more fully with a Johnny on. From what I can see, just some light skin irritations, some areas of larger birthmarks that you may want to make sure you wear proper skin sun care when you're out in the sun. All right, so I'm inspecting the back. I don't see anything that is asymmetrical. The scapula feel intact. Feeling the spine. I don't feel any areas of deviation. Anything painful when I'm touching?
No.
Okay. Rib cage. Intact. Okay. I'm going to have you, let's see. You okay with your legs extended like that?
Yeah.
Would you like it? Okay. I'm going to listen to, actually, why don't you, if you could turn around, put your feet down this way. Okay. So I've inspected, I've palpated, now I'm going to percuss, and just going to percuss down and around your back. Let me know if anything is uncomfortable. Any of that give you any discomfort?
No.
Okay, I'm going to feel down to the bottom of your rib cage. Take a big breath for me. All right, do one more again. Okay, normal expansion of the rib cage. While I'm here, I'm also going to check CVA here. I'm just going to palpate. I'm going to percuss firmly down here, okay?
Mm-hmm.
Looking for kidney pain. Anything painful there? Okay. All right, so now I'm ready to auscultate. Okay, nice big breath. I would be using the diaphragm of my stethoscope. This is a tunable one, so I'm going to do the diaphragm first. Okay, very good. Oops. Now, if I had a bell stethoscope, I would repeat it. I would do that again, just as I was doing before. Okay? Can you turn around and have your feet down this way? Okay, so now I'm going to look at I would expose his chest. I would be inspecting for palpitations, any pulsations, masses, skin color, wounds, any bruises, looking for symmetry. At this point, I'm just going to palpate. Anything hurt here?
No.
I don't feel anything, but I feel feeling the apical pulse here. Okay. Now I'm going to listen again to your front. Before I do that, I'm just going to listen to your carotids. Just breathe normally. Actually, could you hold your breath? Okay. Take a breath. Hold your breath. Okay, very good. I don't see any jugular vein distension at this point. While I'm here, I'm going to look at his trachea. It is midline. I see no pulsations. I see no lumps. Listening for lung sounds. Nice big breath. Okay, very good. Okay. So at this point, you can go ahead and sit back and look at your 45 degrees. You doing okay?
Yes.
So, back, checking jugular veins. I see no distension. I'm going to go right into the arms. Shoulders feel intact. I would look at the skin. Looks like some slight irritation. Look at the arms. Well muscled. Good. Good blood flow. Looking at the hands. Calluses. Where are these from?
Gymnastics.
Okay. Hands feel warm to touch. Half refill. Less than 3 seconds. I feel for pulse. Also going to feel for brachial pulse. So I'm going to test the muscles and strength of your arms. Go ahead and put your arms out straight. I'm going to try to push them down. You resist. Okay, same thing, but upward. Okay. And go ahead and put your arm up. I'm gonna try to pull it back. Okay. And now, put it down and keep me from pulling it up. Okay. Put your arm out. Can you rotate your wrist around? And can you put it up and down? Okay. Can you clench your hand? Okay. Can you spread your hands? And can you touch your thumb to your pinky? Okay, very good. Okay. Resisting? Okay. Resist. Very good. I breathe for less than 3 seconds. I've checked pulses already. Can you do a grip? Okay. And can you, is this the grip? Okay. Can you spread your fingers out? Put them together? Try to pull them apart. I didn't do this on the other side. Okay. And touch your thumb to your pinky. Okay, good. And at this point, go ahead and put your arms up. There we are. Lymph nodes. We'll also inspect. Okay, go ahead and put your arms up to your side. Okay. I'm going to try to push them down. You resist. Alright. Can you put your hands forward, please? I'm going to try to push them down. And up. And up. Okay. Very good. Do some other things a little bit. Alright, anything across your shoulders, back and neck? Okay. I'm going to put you down flat. I'm going to inspect your chest, listen to your heart sounds, and then we'll go into the abdominal assessment, okay? All right, so first I would inspect his chest. I would be looking for any asymmetric shapes, any type of bruising, any type of one side being smaller than the other. I'm also looking for palpitations or any masses or movement. Palpating. Any other start? Your page is symmetrical. Okay. I am going to, at this point, listen to his lung sounds. I'm going to start with come a little bit up and to the left. Alright, I'm going to go into the abdomen. I'm going to expose it. I'm going to look at the skin. For any bruising, any marks around the umbilicus, any change across the diaphragmatic area. Looking for any type of fluid accumulation, inspection. I'm going to auscultate, listening in the 4 quadrants, starting in the right lower. Okay, bowel sounds are all present. I'm going to listen for the renal arteries. I would repeat all this with the bell of my stethoscope. Okay. Next, I'm going to percuss. Let me know if anything is uncomfortable. Okay. Next, I'm going to just have some very light palpation. Anything uncomfortable? Umbilicus. Feel no pulsation, no. And I actually, back in the auscultation, I would have listened for the epigastric, for the aorta, like this. Okay. All right, so there's the abdomen. Next, I'm going to go down to the pelvis. Okay. I would look across the skin, look for any bruising, look for any past scarring for surgical interventions. They look symmetrical. They look muscled. No atrophy. Stable on palpation. Okay. I would, in the hospital, I would perhaps listen, feel for femoral, but I won't do that here. But I will go down to the legs. Legs on inspection look well muscled, good blood flow, some bruising. Okay, I'm going to feel for pulses. Popliteal. And a tib fib. Tubular, posterior tubular. And take this off. Just relax. Dorsal penis. Hair distribution is normal all the way down to the ankle. Okay, capri refill on the toes. Toes are a little chilly from being out here. There's cap refill though. You okay?
Yeah.
All right, so next I'm going to test the strength of your hips. Okay. So I would like you to lift your leg up, this one up. Okay, and down. This one up and down. Okay, now I'm going to try to keep you down, lift it. Okay, and this one. Okay, very good. I'd like you to lift this one over the other one. Okay. And lift this one up and over. And now this one out. And this one out. And we'll check your push against my hand. Okay, now pull back. Okay, push against my hand. Pull back. Okay. You're going to lift this leg up. Okay. You roll it. Okay. You roll it out. Okay. Now, can you resist me pushing you to the side? Break down, no calluses and no growth on the feet. Have arches. No abnormalities or gross swelling in the ankles, no edema. They were a little chilly, like I said, from being out here. You have tell me which toe was hurting? What?
Right. One to the left.
Okay. Good. Have you sit up and put your legs down over that side. And then cross your legs. All right, so I'm going to test some of your reflexes. Okay. A little hammer, so what I would do is I would use a little hammer to hit the bottom of the patella, and I would expect to see a little reflex. May not work here. I'm going to check some cerebellar control. I have you use the opposite heel to run down the front of each leg. Okay. Very good. And actually do this one more turn. I'm going to Levinsky. Negative. Okay. All right. I'm going to test your sensation. I have this little piece of cotton. I'm going to touch it different places. I'd like you to close your eyes and tell me where I'm touching it.
Right side of my face. Left arm. Left calf. Right arm. Right foot.
Okay. All right, I have a couple items that I'm going to put in your hands. I want you to tell me what they are, okay? Here's the first one.
Screw.
Okay. And
Key.
okay, perfect. I am going to, with just this closed pen, write a number or a letter on each of your hands. Let me know what you feel I'm writing, okay?
Letter T.
Okay. And this one?
Number 8.
Number 8, okay, good. All right. So, I'm going to test the strength of your legs at this point. Can you lift your legs out? Then I'm going to push down. Okay, and I'm going to pull up, you push down. Okay. Same thing, push out, and now try to pull up. Okay. And can you put your toes up in the air, down straight, and rotate? Okay. Any pain, discomfort there? Can you curl your toes? Okay, and good, that's good. All right, any dizziness, any change, any pain? Okay, so I'm gonna have you stand up. Okay, so I'm gonna have you walk over to the ambulance, just walk normally, and then stop and turn. Okay. Now come back this way, toe to heel. Okay, very good. Now walk back on your toes. And now on your heels. Okay. Now I'm going to have you do a test on the Romberg test. And I'm going to have you to stand here with arms at your side, legs together, and eyes closed. And starting now. Okay, good. Let's see, I'm going to have you lift one leg and do a shallow knee bend. All right, and now the other way. Okay, good. Any dizziness or feeling like you're losing your balance?
Nope.
All right, I'm going to have you bend down at the waist and kind of curl your spine. You don't feel any abnormalities in the spine. Okay, come on up. Just wait a moment. Now I would like you to do a bend to the side. Okay, and now a bend to the other side. All right, and now a twist one way. And then a twist the other way. Okay, good. I'm gonna go back to the ears. I forgot to do the whisper test. Okay, so I'd like you to cover the other ear, and I'm gonna whisper something, and you just repeat what I hear, what I say, what you hear. Okay.
Nice job, Kenzie.
All right, let's switch.
I like being impatient.
Okay. All right. Okay, let's see. I'm gonna check my paper just once. Oh, I just want to do two more things. Okay, could you sit back down? Yes. All right. I'm going to put your hands out straight. This is going to be a test to check for your cerebellum back here being coordinated. Hands back and forth quickly. Okay, very good, very good. And let's see. There was one I think I saw. Let's see. I'll go through my neuro exam again. Rotation. Can I see your feet? All right. I'm going to lift. Actually, let's see. I'm going to lift or depress one of your toes. Okay.
All right.
You tell me whether you're going up or down.
Sounds good. Up. Down. Down. Up. Up. Down. Up. Up.
Okay. Good. I think I've hit about everything. I'd like to thank you for this and have a good day. Thank you. That's it.